Thank you, Patrick. Hello and good afternoon, everyone. My name is John Cullinan. I'm a lecturer in economics at NUI Galway, and together with my co-presenter, Orla from the Irish ME CFS Association, we're going to present today on a patient academic research collaboration that examines the economic impact of ME CFS in Ireland, and in particular, which is looking to develop patient-driven research in this area. So before we talk about the collaboration and the research, I'd like to start by telling you a little bit about ME, which stands for myalgic encephalomyelitis, and which is also commonly known as chronic fatigue syndrome, or CFS. ME/CFS is basically a chronic disabling neurological condition. It's characterized by a range of symptoms, including most specifically post-exertional neuroimmune exhaustion or post-exertional malaise. It mostly affects adults, but it can also manifest in children, and it tends to be much more common in women by a ratio of about 4:1. One of the key problematic issues around ME/CFS is that routine diagnostic tests or biomarkers are not available, and this means basically that diagnosis is problematic, it's very difficult, and diagnosis is generally made via a symptoms checklist, and often only after a range of other possible causes or explanations have been ruled out. In fact, recent evidence from the United States suggests that the majority of patients or people with ME remain undiagnosed. A second complication around ME/CFS is that the condition is generally not well understood by medical professionals, and that's probably something of an understatement. There's a lot of evidence that suggests that most medical professionals seem to think that ME is a psychological condition, which it's not. It's very definitely a neurological condition, and this is really problematic for a lot of patients. When you combine that with the fact that there isn't a biomarker or a diagnostic test, what it means is that many sufferers face considerable difficulties getting appropriate diagnoses, treatments, and supports. So another really important thing to note here about ME is that it's not a rare disease. This is a relatively common condition. So for example, it's thought that there are between 10 and 15,000 people living with ME in Ireland, for example. There are 250,000 people with ME in the UK. There are around 2 million estimated to be living with ME in the European Union as a whole. And like all illnesses, there's a spectrum of severity, but for many, ME can end up being a career-ending and life-destroying disability. At its most extreme, patients with ME end up housebound or bedbound and often unable to do even very basic tasks. So overall, there's very little research on ME or CFS in the Irish context. I'm only aware of 2 previous studies that have looked at ME in Ireland, and there's nothing at all on the economic impact of ME. And this is problematic because looking at the economic impact of a condition like ME is one way of highlighting the need for greater recognition of a condition such as ME by medical professionals and policymakers. When we look at the economic of the condition, both on the economic impact of the condition, both on the individual, but also on wider society. Another important factor here is that there's a long history of ME patients being ignored, excluded, or even vilified. If you're interested in this issue, I'd highly recommend the documentary by Jennifer Brea. It's called Unrest, and it's widely available online and also on net, and is well worth checking out. But because of this long history, there are now repeated calls for patients to be at the center of research relating to ME and CFS. So Orla and I were very fortunate that an opportunity arose through CESP to form a community academic partnership. So we've been working together now for just over a year. We set out at the start to develop a collaborative, patient-driven research agenda and approach to examine the economic impact of ME and CFS, or CFS. Basically, our idea is to generate evidence in relation to the costs that patients face and the wide economic costs and costs to society, to influence healthcare providers and policymakers in order to provide better services and supports. Ultimately, our goal here is to improve the health and well-being of patients living with ME/CFS. So this picture here is the core research team. This is me on the left, Orla in the middle, and Leanne Black on the right. Leanne joined us at the start of the project. She was employed as an RA on the project, and she did great work throughout the focus groups that Orla is going to speak about in a moment. So if you're watching in online, hi Leanne, and thanks for all the great inputs. But what I'll do now is I'll hand over to Orla. She's going to introduce herself and the Irish ME/CFS Association. She'll talk a little bit about her experience on the project and with CESP, and she'll also discuss some of the preliminary research findings. So I'm going to hand over now to Orla, who will take it from here.
Hello, my name is Orla and I'm with the Irish ME/CFS Association. I have ME myself since 1998 and I've been volunteering with the association for over 15 years now. So I'm just going to speak first about how I was initially approaching this project and how this changed over time due to the Community Engaged Scholars Programme. Then I'll talk about our research, some of our findings, and John will come back in at the end to sum up and talk a little bit about our future research plans. So when John initially approached us about with the plan to collaborate on a research project, I viewed it as John's project essentially, where we would get some input. Even after we applied to the grant from PPI, I still viewed it essentially as John's project. So it was only after starting the Community Engaged Scholars Programme that my perspective started to change. I realised that the programme was encouraging a more fundamental shift in thinking about how to approach research. So over time, I realised that we could shape and actually do the research more as an equal team. Once we started the work of organising and doing the research, we were working as a proper partnership, I think. So initially it was myself and Tom Cullinan, who lives in Dublin, who were the patient representatives. But once I saw the amount of work involved, I asked another local patient to join so that I would have local backup and to try to make sure that there would be a patient representative at all of the training sessions. So Leanne Black joined us at that stage and she was studying health studies at NUI, Galway. So the CESP influenced our research in other ways as well. After the session on qualitative and quantitative research, we started to re-examine our research plan. So we decided to change our original plan, which had been to do a mixture of qualitative and quantitative research, to instead take a solely qualitative approach in the form of focus groups. So we're actually viewing this as the first stage of a bigger research project, really. So we had some extra tuition from Bláithín Casey, who was experienced in qualitative research and the PPI approach. She also attended the first focus group we did as backup and also to help train Leanne into how to take observational notes during the focus group sessions. So I'm going to talk now a little about how we did the research and the patient representatives part in the research process. So we did 3 focus groups in 3 parts of the country with 21 participants altogether. We had a mixture of patients and carers attending. We advertised them via patients groups. Tom Cullinan did a lot of work advertising the focus group. We also got some help from a carer and a sufferer in Cork, and Leanne Black did a lot of the dealing with people who came forward and organising the venues. So we aimed in the focus group to have a bit of a mixture in terms of ages, to have a mix of carers and patients and people who are working and not working, so that we would hear about a range of experiences, and I think we managed that quite well. One advantage of having patients on board with the research project is patient recruitment, but there are sometimes other things a patient might approach differently to a researcher, or just areas where they can be of assistance. So these would be things like which areas to focus on in the research, and practical things like the participants of focus groups might benefit from having access to food and drink, that they might need breaks, if possible to have a rest area or even lie down at the group, and so on. So as patient reps, we participated in all aspects of the research. That was deciding how to do the research, ethics application, writing the patient information leaflet, and running the focus groups. We're currently analysing the data and hoping to submit a co-author paper this summer. So this activity and training, I think, has given us a good grounding in how to run a research project. But also for me, I think it will give me more insight into other research, maybe making it easier to evaluate other people's research as well. So one thing we found from doing this work is that there was a very strong interest among patients in participating in research, despite this being a lot of effort for some of the participants. This is probably partly due to patients feeling like they're not being heard. One patient summed this up when she said, "My husband said to me, 'What the hell are you doing this for today? Like, I have to bring my son to the doctor tomorrow.' I said, 'I feel like I have to say something, you know, because nobody is listening. No, you're invisible. So this is our opportunity just to say it.'" So I'm going to talk now a little bit about our findings. And so a few issues we're working on the thematic analysis at the moment, and a few issues are coming up consistently. So problems getting a diagnosis is very common, but sometimes it's taking a few years and multiple doctors to get a diagnosis. And I volunteer with the association, and this is something that we come across very frequently in inquiries to the group. And then back to the research, also people having problems with healthcare professionals and people running services not having knowledge about the condition. Tests and treatment costs, which are often not covered by the health system. Impact on ability to work and on education. Impact on carers, for example, the time taken in caring, and also things like we had one person who had to take early retirement to care for an adult child, for example, and a few others who weren't able to work due to caring for adult children. Extra costs of living with a disability and lack of supports, and the lack of understanding feeds into that a bit. So just to give you an idea of the problems with lack of understanding of healthcare professionals, I'm just going to quote one carer, and her son has it. We're kind of hitting a wall with a few different GPs, you know, like one just totally not believing, but it's just to show the kind of lack of understanding and education. And despite me saying to him, "Well, you know, the World Health Organization have recognized this as a disease. Are you telling me you don't believe it exists?" And he said, "Yes, I don't believe." He said with her son, "I'd like to start again." So anyway, he's on a waiting list for a diagnosis, an Irish diagnosis. And this is a different example from somebody who had to give up her job. Loss of income is phenomenal. I've lost an annual income of around 100,000 a year. I haven't been able to return to my job for several years now. I tried to reduce my hours. I tried to work part-time. Eventually had to give up. So financially, the implication is huge. And I'll just hand you back to John now, and he's going to sum up some final thoughts.
So thanks very much, Orla. Just a couple of final thoughts. We're making good progress in terms of the thematic analysis of the focus groups. Both Orla and I are working on that together, and we're hoping to finalize our results and findings pretty soon and to submit a journal article later this summer, and that would be, I suppose, the main academic output out of the work. But I think much more importantly, what we're really planning to do is to share our results much more widely with a range of different stakeholders. And in particular, we see three different groups who we think should be interested in our results. The first will be ME patients themselves and their representative groups. Secondly, healthcare professionals and policymakers. And thirdly, the general public. And we see that, you know, part of the research we're doing, this will be, you know, important to try and increase general awareness around the condition amongst the general public. In terms of my own perception as a researcher, having been involved in this PPI approach, I think there's been huge benefits to the really high levels of patient involvement in this research project. It really has, for me, opened my eyes to see the value of patients doing research with patients for patients, and I think it'll really enhance the quality of the work that we're doing and lead to, I think, a much better set of research findings. And then just the last thing I'd say, we've been working together now on this for a year. We're almost finished this particular component of the research, but we do have a number of plans to continue to do future research we have a few different ideas, and one of those would be to undertake a national survey on economic costs. I think we've got a lot of really useful information from the focus groups, and we want to build on that in order to try and do a more quantitative analysis and to put some numbers on some of the findings that we found through the qualitative research. And that's something we're hoping to do in the near future, and we're hoping that we can continue on this really successful collaboration. So I'm going to finish up there. I just want to stop by saying thank you to a few people. I want to thank the PPI Ignite and the CESP teams in particular for all of their great help over the last year, in particular Adele, Martha, Sean and Sharon for all of the great inputs that they've made. So thank you to them, and thank you to all of you for listening to Orla and I today.